Hi, welcome to Mommy Talks Breastfeeding. Mommies and the D wants to celebrate Black Breastfeeding Week by giving you all conversations around breastfeeding. Mommies and the D's vision is to provide a safe space for young mothers to learn how to advocate for themselves by providing them the necessary tools to make choices that benefit their children and themselves in the best way possible. And we felt this would be best. So, what are Mommy Talks, you might ask? Mommy Talks are a series of talks where we speak about important topics every mommy should know. And we are going to be joined by our facilitator today, Iyana Dalton. And we also have our amazing panelists. Lashara Johnson is the owner of Latch and Love Lactation Center in Atlanta, Georgia. And we also have Pyrnie Calloway, who is a nutritionist, CLC, breastfeeding coordinator at Hamilton Health Center, and she is in Harrisburg, Pennsylvania. Also, we have Samantha Thomas, who is a labor and delivery nurse in San Francisco Bay, California.
The first question I'd like to ask is, what is the anatomy of the breast and where does the milk come from?
I can start.
Okay.
Let me see. Let me bring up the breast model. So I have a little breast model here. So this right here is, of course, supposed to be the nipple, and the dark area is supposed to be the areola. So a lot of moms will say, well, my nipple is huge. But they're really not referring to their nipples, they're referring to the areola. So the areola becomes darker and larger during pregnancy. So it makes it easier for the newborn to see the target once he comes out of the canal. So that's just the basic anatomy of the outside of the breast. There are a lot of things going on the inside of the breast as well. So on the inside, I don't know if you guys can see this, but it's almost like where your milk comes from is like a cluster of grapes. So each individual, you have each individual grape on like a cluster, and then you have the whole group of grapes, but that one little grape is where the milk is made. And so your prolactin hormone triggers things in your body, and you will collect nutrients and protein and sugars from your blood. It goes into that little grape, and then that's where you make milk. And so each cluster is surrounded by something called like myoepithelial cells. So when you have when oxytocin is released, those myoepithelial cells contract, and then the milk will then run through the ducts, and then they will go through ducts, and then it will go to the nipple, and then you have your milk. So that's just the basic anatomy of the breast and how milk is made.
Thank you very much.
I also wanted to even reiterate that we have those, the outside of the nipple, we have the nipple, we have the areola, which is the dark part. I always say the dark part because not a lot of people know what an areola is. And then we also have our skin. But even with all of that and what's going on in our breasts, it's stimulated with even prolactin, which is our milk production. That's very important. And also oxytocin is one of the things that causes our milk to flow. So it's our milk ejection reflex. So it can be stimulated by touch, by massage. A baby can, lay his or her hand on your breast, and it can cause milk to flow. So definitely oxytocin and prolactin is very important for milk production.
What is the anatomy of the breast? Each breast has about 15 to 20 lobes of this fatty granular tissue, and those granulars kind of branch off into these smaller lobes, and that's where the milk is produced. Those are called the milk ducts. So where does the milk come from? those milk ducts transfer milk into these reservoirs called alveoli, and those are right under the nipple. And when you, even before you give birth, actually, you might start to see that milk production starting to come through those alveoli in the nipple. And once your baby is born, your breasts are usually ready to go. Even if there's not a whole lot of milk coming out, those ducts are ready, and the milk is under in those alveoli, in those reservoirs under the nipple. And it's really fascinating.
Thank you very much. Is there anything else you guys would like to add on to that?
So on your areola, you have little bumps called Montgomery glands, and they secrete this little oil that helps to the nipple or the whole nipple area like moisturize and help prevent cracks. But it also has like antimicrobial properties, and it smells like amniotic fluid. So when the baby is born, it kind of attracts the baby to that area. So our breast has so many different things going on with it.
Yes. Yes, and I love it.
Can you explain the 3 phases of breast milk?
We have, it's called lactogenesis 1, which happens from the 16 to the 20 weeks of pregnancy. So you start making milk when you're pregnant, during your pregnancy. So we have those milk synthesis, and you might even see towards the middle to end of your pregnancy, your breast might even start to leak milk, because your body is making milk during your pregnancy. Also lactogenesis 2, this process begins at birth, and it completes within the 30 to 72 hours after birth. A lot of women, they they might have problems with lactogenesis 2, so it might get delayed due to some different factors. Maybe they're obese, or something happened during the birth, if they had a C-section, or some kind of traumatic birth. So that lactogenesis 2 could be delayed on the onset. But after lactogenesis 2, if it's successful, and then it's lactogenesis 3, which is the establishment of milk supply. And that usually happens from days 3 to 5. So even from lactogenesis 2, I don't know if you heard of colostrum, which is that golden milk. It's making that. And then lactogenesis 3, it starts to mature into the milk supply, and we want to empty the breast as much as possible to keep that, to maintain that. So Tashara, you probably have a little bit more to add.
You mentioned the colostrum phase. We have that. So, you start making that, like Pyrnie said, during your pregnancy. So after about 3 to 5 days after the colostrum phase, and you go into your transitional milk. But, the colostrum phase is really important, because that's where a lot of our immune protection comes from. So the colostrum is like very thick. You get smaller volumes because the baby's stomach is smaller. And it's like high in protein and that stuff. So, that phase is like really, really important. So after about 3 days, then your milk begins to transition. So from the colostrum now mixes with mature milk. And so during that period, that's engorgement comes in that, mom's milk fill up because you're getting more volume. That milk is tend to be kind of like whitish bluish in color during that period. And that happens up until like about the 2nd week. So after the 2nd week, then you go into your mature milk, where you make your fore milk and your high milk. And so the fore milk is more almost like giving your baby 2% milk. So the baby gets lots of its hydration and a lot of lactose from that. And then the high milk is more the fattier milk, where your baby becomes more satisfied because it's higher in calories and fat. So, yeah.
This is really one of my absolute favorite things to talk about because, as I may have mentioned, as a labor and delivery nurse, we work with mamas in, you know, the first 2 to 3 days of baby's life, their first 2 to 3 days of their journey of breastfeeding. So the first phase is something called colostrum. Colostrum we call in the hospital and probably everywhere else liquid gold. It is just so rich in nutrients and vitamins and minerals and all these wonderful things that your baby needs. And I explain to my mamas when their babies are first born, their stomachs are just like the size of a marble. And so they don't have to eat this large volume of breast milk. And so your body compensates for that by giving them more nutrients in a smaller amount. And that's what colostrum is. I really just love colostrum so much, especially my mamas who have premature babies. That colostrum, your body has specially made for whatever phase of life your baby was born in prematurely. And it's specifically designed to help them move through those early phases of life and make it to a full-term age. Usually this is before you get discharged from the hospital. So we do a lot of pumping and hand expression to get that liquid gold to that baby. The next phase of breast milk is called transition milk, and this is a mix of the colostrum and the what eventually will be mature milk. And this is just a transitional phase of the milk, 3 to 5 days after delivery, and then another few days to a week after that, you'll see phase 3 of the breast milk, which is mature milk. Mature milk is so fascinating to me because it is 2 parts to mature milk. There's the foremilk and the hind milk. The foremilk is a little bit watery. You won't see as much color in it. It doesn't have as much fat and sugar in it. And the hind milk, of course, a little bit more sugar, a little bit whiter in color, or that sort of, not white, but that sort of classic sort of yellowish pinkish color of breast milk. And that one, like I said, a little bit more fat, a little bit more sugar. And what mature breast milk helps a baby with is something called satiation, where it's almost like eating your vegetables before your dessert. And so it tells baby, all right, let's get started. I'm hungry now. I'm going to start with, you know, a little bit of this, and then then the more of the hind milk comes out, and it helps baby sort of understand the process of eating instead of going straight to your dessert and the sugary high fat push you straight to sleep. It helps them do the work of feeding to get to the higher calorie hind milk. And so I really love the 3 phases of breast milk. In all of those phases, the breast milk does some wonderful things where putting your baby to the breast helps the breast read the baby's antibodies, which is just like so fascinating. And the mom will in turn create whatever antibodies baby needs to fight off any infection, help with clearing the bowels in those early phases. So breast milk is a really, really fascinating food, and I just love talking about it, especially the colostrum.
What are some tips for new mothers for breastfeeding during the first week as milk is transitioning? What remedies are there to adjust to the body's changing?
So during the first week, as your milk is transitioning, your body is adjusting, your breasts get really hard and really swollen, and you become engorged. And so with engorgement, it's so important that you're constantly putting your baby to breastfeeding, you're putting your baby's skin to skin. But if breastfeeding becomes painful, or just that engorgement becomes painful, there's just a couple of things you can do to kind of relieve the engorgement. You can start off by putting something warm on your breasts, like towels, or you can take some rice, uncooked rice, put it in a sock, place it in the microwave, heat it up, and place it on the breast, because the rice will hold the heat longer than a warm rag will, or a warm towel will. Give yourself a nice breast massage, and then you can go ahead and start breastfeeding. One thing you can do to kind of help empty the breast during feeding is compressing the breast while feeding, to kind of transfer more milk to the baby. And then when the baby is done feeding, go ahead and place something cold on the breast for extra relief and kind of get the extra fluid from running towards the breast.
So also to add to that, it's important to know your body. So when I work in the hospital, so I see them from days from 1 to about, it depends if they have a C-section, day 4. So I always kind of remind mom to, you know, empty the breast, you know, frequently breastfeed. Because even at day 2, I call it cluster feeding. Baby tends to feed more frequently, and moms, you know, they kind of perceive that they don't have as much milk. But, you know, if you're doing that skin to skin, which is super duper important, and keeping that baby near you and feeding frequently, you'll be able to keep that that breast milk going, and you'll produce more. So Lashara talked about engorgement, which happens, you know, a lot of times, you know, might have a lot of IV fluid, might have, you know, baby's not latching correctly, and it can cause the breast to be very hard. So it feels like your forehead when it should, you know, should feel soft. So it's important to, you know, get that milk out. So I always do like a reverse pressure softening, which is, you know, you're going around your breast and it's kind of like pedals, and, you know, you're squeezing the breast out and it's stimulated in that way. But it's important to just get that milk out, maintain that milk supply by doing skin to skin, knowing your body. So you want, you know, when your breast is full, you're going to feel that fullness, you know, you're going to feel it. It's going to feel kind of heavy, or, you know, kind of harder. It should be soft when it's empty, but definitely knowing your body, getting rest. You know, I know that sounds very simple, getting rest, and, you know, just knowing what to expect that first week, because it's very crucial.
How much should a baby eat? How do you know if the baby is having enough milk or is eating enough?
So if the baby, how much the baby should eat. So you basically should be breastfeeding on demand, never necessarily by a schedule. So if you're feeding the baby on demand, how you can tell if the baby's getting enough or getting enough to eat, you'll notice that baby is more relaxed. So baby's fist might be like this at the beginning of feeding, and by the end it should be relaxed, sleepy. So I always, I work for the WIC program, so I always tell moms to know those early feeding cues, because if you know those feeding cues when baby is, you know, kind of rooting for the breast, and, you know, maybe putting hands to mouth and things of that sort, you'll know that that baby's ready to feed. So you don't want to wait till the baby's crying and fussy and, you know, all those things, because that can cause other problems later. So other things to tell if the baby has wet and poopy diapers. So, you know, whatever's going in is going to have to come out, you know. And then also proper weight gain, which could be, and, you know, I work for the WIC program, so we have the WHO charts and the growth charts and things. So if the baby is feeding enough, you should be able to tell by proper weight gain as well.
How much should a baby eat, and how do you know if your baby is having enough milk or eating enough? So when I work with mamas in the very early stages of their baby being born, and I always say, if you're breastfeeding that baby, let them eat as much as they want. There's some sort of secret code between a baby and a breast, especially in the early phases, where the baby will eat just enough once they get the rhythm of breastfeeding. We tell our moms, you know, every 2, no more than 3-4 hours to eat. But I say, if that baby is asleep and you just fed them 2 hours ago, don't wake that baby up. You know, maybe give another hour or so, see if baby starts giving you any feeding cues, and feed the baby when they're ready. And when they're done, when they're not interested in the breast anymore, they're just gonna stop. They won't overfeed themselves in those early phases on the breast. How do you know if your baby is having enough milk or eating enough? Obviously, in that first 24 hours for us of baby transitioning from being in the womb to out of the womb, there's a lot of things going on. Their intestines are, you know, getting ready to start doing their thing. Their whole GI system is getting itself together. So in the first 24 hours, we're very gracious with babies, and we're not really big on them eating all the time, every 2 to 3 hours. It's okay. But I always tell my mamas, if something's coming out, then something's got to be going in. So that first day, we watch for a pee or a poop, and that's how you know going forward. If your baby stops peeing, they're probably not eating. Something's going on. There's some sort of dehydration. If your baby's not pooping, they may not be getting enough to eat. So let's talk about supplementing if we have to, or more ways that we can help you produce more milk. So babies are very good at sort of regulating their own diet, especially in the early days. Okay.
Mothers get frustrated with their baby's inability for the baby to latch on to the breast, and this may cause them to stop breastfeeding. What are some tips for helping a baby latch on?
If baby isn't latching, mom needs to get help. So if she's in the hospital, she can request for lactation to come in and help her with latch. If mom is discharged from the hospital and she's having issues with latch, you know, some hospitals have like free outpatient lactation support where she can go back to the hospital and get help with latch. She can go into her community to programs like the WIC program and get help with latch. There are a lot of orgs in the community, such as Rose that we have in Georgia, where you can go and get other support. Some pediatricians' offices may have lactation support there, but you most definitely don't want to forget about your birth workers. So your birth workers, like your doulas and your lactation consultants, and all these people in the community are here to support moms. So they most definitely, they don't know anyone, start Googling and looking them up. But all mothers prenatally should have their team set up. They need to know who they're going to go to for lactation support. They need to know who their pediatrician is going to be. They need to know all these things before delivery, so when they need them, they already know who to contact and get support from.
Exactly, and it's important to kind of get that support ahead of time. And a lot of women that, you know, there's a lack. They say there's a lack of support, but if you really look into the support that you do have, even if it's a mom that has your mother that breastfed or your grandmother that breastfed, you know, you have that support from your family. But it's important to get, you know, those lactation specialists, consultants, CLCs, WIC nutritionists and counselors or peer counselors to get that help as well. So that'll definitely help the baby to latch better. If you feel, you know, a lot of women, they discontinue because they feel like they're not making enough, or, you know, they might have sore nipples and things. Definitely don't be afraid to get help. That's important. Get help. So.
Some things moms can do on their own is making sure the baby's positioned well, having babies close to you, you know, not trying to breastfeed your baby like you're feeding a baby doll. You know, you have to bring them close, bring them in, tummy to tummy, and making sure babies is opening very, very wide. So what I noticed when I help moms with breastfeeding, they're trying to take their nipple and they're like trying to shove it in the baby's mouth, but you have to be very patient and allow the baby to open wide, like he's going for like a large bite of a burger before allowing the baby to latch on. And if he's latching on just to that nipple, just taking your finger, breaking the seal, and then offering the breast again when he's opening nice and wide. If that doesn't work, of course, like we were saying, just go ahead and get some help.
How long is it recommended to breastfeed?
So the American Academy of Pediatrics suggests at least 1 year, and the World Health Organization suggests at least 2 years. I know the Healthy People 2020, they have a goal of at least 6 months to a year. So I always say 6 months to a year is a good goal to breastfeed.
And I think it's just based on, you know, that mom's goal and her family, and, you know, you have to look at situations like that. But I always tell moms, you know, if they want to get bang for their buck, shoot for the 2 years, because your baby's brain doesn't stop developing until around 18 months to 2 years. So you want to make sure your baby can get as much breast milk as possible. If moms aren't exclusively breastfeeding, that is okay. Some breastfeeding is better than no breastfeeding. So if they're doing both, it's totally fine as long as your baby is getting that breast milk for as long as possible.
What are some resources should moms look for if they are looking for help breastfeeding?
Definitely, you know, like I said, even with the WIC counselors or peer breastfeeding counselors, breastfeeding support groups. There are many out there like Rose, and, you know, and there's different people that have the breastfeeding support groups, local lactation consultants, reliable internet sources. So you have your womenshealth.gov. They actually had an initiative for African American women. It's called It's Only Natural. WIC also has a WIC breastfeeding support. There's warm lines. There's a lot of resources out there. You just definitely have to know what's in your community. And usually in the hospital, they will give you a list of resources in your folder. So look through that folder, and, you know, you can see all of that. And also ask your WIC nutritionists or WIC counselors what's out there, and your lactation consultants.
So Lashara and Pyrnie, could you all please tell us about your events you all have coming up?
So on next Saturday, August 28th, I'm hosting a free virtual breastfeeding class. So you, if you're interested, just send me a text message on the number on there, and I'll send you the link to the Zoom call. You can attend, your partner can attend, have your doula attend. So yeah, just send me a text message and I'll send you the information for the event.
And also, I'm doing a virtual Black Breastfeeding Week celebration. As breastfeeding coordinator, I wanted to bring awareness to Black Breastfeeding Week. This will be actually our first Black Breastfeeding Week celebration, so I'm super duper excited about it. We're trying to debunk the myths of breastfeeding and highlight the disparities of Black infant mortality, and provide solutions and strategies. So we have lactation professionals, we have doctors, we have breastfeeding mothers, and we want everyone to join in on this Zoom call. So how you can reserve is through Eventbrite. So that link will be available. And so it's a virtual online discussion, roundtable discussion about Black maternal health and just Black breastfeeding in the community.
And also for Detroit Mommies, we have some other resources for you all. So the Safe Sleep and Car Seat class is offering virtual classes on Tuesdays and Thursdays. You will receive a pack and play and a car seat after completing the class. And you all can call 313-961-2229 or 313-961-BABY. And please tell the Mommies and the D and Myrisha referred you. And then we also have community baby pantries. So this is where you all can find used and new baby items, from strollers, bedding, clothes, and toys, and so much more. For more information, please give us a call at 586-834-8668
or you all can call again 313-961-BABY. Rema International Church is hosting the Community Baby Pantry, and you all will find the address below. So I want to thank Lashara, Pyrnie, and Samantha for being able to tell us a little bit more about breastfeeding basics. And this is a great opportunity for you all to learn a little bit more about our panelists and how to follow them. For Lashara Johnson, you can follow her at her website at www.latchandlovelactation.com. You can also follow her email at info@latchandlovelactation.com and her social media platforms at Latch and Love Lactation. Pyrnie also can be followed at PyrnieCalloway@gmail.com and her website at www.pyrniesay.com, where she has blog posts. She's also a singer and a writer, so please go ahead and follow her and see some of her work. Also, you can follow her at her social media platforms at Pyrnie Say. And Samantha Thomas can be contacted at janine.thomas@gmail.com. And also on her social media, she would love for you to reach out at sam_bam_bam.